Hello again and welcome to this COVID-19 update for you and your community here on the Bass Coast, presented by Bass Coast Health. Well, it doesn't get any higher this time. We're going right to the top. It's the CEO of Bass Coast Health, Jan Child, joins me. Hello, Jan.
Hello, Kevin. How are you?
Good to have you. Great,
nice to
thank
be
you.
here.
I think because you're here, we should both
Well, definitely we should be doing this.
do the right
It's so
thing.
good that we've got them here.
Yes, indeed.
And it's got over 70% alcohol, the most important thing for a sanitizer.
And I got taught exactly how to do it the other day.
Absolutely, between the webs, don't forget the thumbs.
No, Nikki was good at that. Right, well, we've heard so much about the preparation that is going on at Bass Coast Health right now. Jan, tell us why so much work is being done.
Well, we haven't done pandemic before in Victoria. I've been nursing for many years and this is probably the biggest risk issue that we've managed in the health sector. And understandably, there's a lot of planning and support and resources going into making sure that we keep our communities safe. The Commonwealth Government, the state governments, all of the institutions, Safer Care Victoria, have been marvellous in actually making sure that we're the best equipped that we can be to save lives. And what we've seen overseas is just so tragic, and we don't want that to happen here. And the governments, the health services, all of the staff are doing everything that they can to make sure that we can mitigate that. And the best way to mitigate that is to put in place some really proper planning processes to make sure that we're able to still see our patients who normally come through our doors, our stroke patients, our cardiac patients, our older people who have falls, all of those people who don't have respiratory symptoms. We need to make sure that there's places that they can be treated where they're not exposed to the virus and they're still able to get the same sort of care that they would have got 3 weeks ago or 3 months ago. And so we're rezoning all of our health service to be able to provide the usual care that we provide, but we're also really redeveloping our health services so that we can manage an influx of patients if we need to. And we hope that, we don't become like what the United K is today, or Italy or the States. But we've got a plan to make sure that if that were to happen here, that we're in the best possible position to look after our community and to save lives. And so the work that we're doing around the hospital at the moment is about creating zones, and in our language we're calling them hot and cold zones. So
yeah, that makes sense, doesn't it?
Yeah, the zones are about saying if you are not at risk of respiratory illness, you're not already infected with the COVID or influenza or rhinovirus. And I will say that there's a lot of influenza and rhinovirus already about. We don't have any COVID patients in our hospital at the moment, but we are absolutely expecting to. What we want to be able to do is to keep those patients separate to the other patients. And so we're calling the zones that we're getting ready for those respiratory patients hot zones, and we're calling the zones that we're getting ready for our usual patients cold zones. And we're separating really our work into two types of hospitals so that we can provide that care and that continuity. And that's been enormous. We've shifted offices for people. We're creating new treatment areas. We're busy renovating. I've got all of our engineering team and a lot of local builders working on all of the things that we can do to get those buildings up to speed pretty quickly. And over the last couple of weeks, we've been able to change our mix so that we can have, instead of just 26 acute beds available, we'll actually have 26 acute cold beds, and we'll have about 50 hot beds. We are anticipating that we're going to have more numbers of hot people than cold people, so COVID or influenza respiratory people than our normal people, and so we're zoning our hospital to get ready for that.
All right, so how are the staff handling the extra workload and how things are changing so much, as you've just described, in the hospital environment?
Yeah, Bass Coast Health has amazing staff, Kevin. You've seen that over the last couple of weeks. They've been through a lot over the last few years. We've pushed through a lot of change that change has been about us becoming a sub-regional health service and then growing our services. And for them, this is just one of those other things that we need to do to provide care for our community. And so I think they're reflective of the general community too. We have staff who are, okay, let's get into it, let's get ready, we're pumped, we've just got to do this, and we'll be ready. And then we've got staff who are scared and they're worried about, you know, what's going to happen.
But that's only natural, isn't it?
It's
surely?
absolutely natural. We've got to be allowed to talk about where we're at in that, because it's a personal journey for all of us, and you know, we'll all move through this in different ways, and our staff, I think, are really reflective of that. And so, you know, our biggest focus has been on trying to make sure that they're safe. You know, we've had the enormous support of Bass Coast Shire Council, who have given us this big building, and we're today relocating a lot of our staff who wouldn't be involved in the day-to-day clinical care of our hot respiratory patients. We're moving those people into that room today, and that means that they'll be away from, you know, the respiratory patients. They'll be away from, you know, the hustle and bustle of what's happening, and be able to get back to doing their normal business, which is what we want them to be able to do. So I think all of that planning is going to help the staff feel that they're safe, that they can continue on to do their work. And, you know, I think that our doctors, our nurses, our cleaners, our ward clerks, our builders, everybody has just done what they do at Bass Coast Health, and they've jumped in and said, okay, well, let's get on with it and sort it.
It can't be stressed enough how important it is to continue to do the right thing, Jan. So I'd love to ask you, what are your top 3 things to do to keep us safe, to stop the spread of COVID-19?
Yeah, really strong message about staying at home. And, you know, I'm really pleased with that message. And I have seen on some mediums where it's become a divisive message, and I don't think it's meant to be divisive at all. You know, for our staff, for our patients, staying at home means that you're not going to have contact with 1, 2, 10, 20 people in a day. The less contact that everybody has with somebody else, the less spread will happen. It's as simple as that. And even going to the supermarket to buy the essentials, you know, I love the supermarket. I used to go every day, and I've now got it that I will go once a week with a list, and I'm in and out really quickly. We've got to be really clear about those essential jobs that we do, and I'm a really keen gardener. It breaks my heart that I'm not going in to buy pansies to repot my petunias, but I don't think that that means for me staying at home. Staying at home means that, you know, we're having as little contact with the rest of the community as we possibly can, and that we're doing that from our homes. You know, my daughter, she's 21, she's started FaceTime parties with her friends.
Yeah,
those are the things that we have to do.
Yeah.
And I think that staying at home message, if people just understand that if you don't touch that one person or you don't touch that one object, the chances of you getting the virus, or the chances of you carrying that virus to other people is diminished. And so stay at home, please.
That's the big one.
And what you do when you do that is that you save lives. You know, you actually stop that peak coming into our emergency department, and we're really worried that we're not going to have enough staff, enough rooms, enough people if Italy or the United Kingdom came our way. And so staying at home means that you'll actually help our staff manage through what will already be a peak influenza season and peak other times. Second message, you can call it stay at home, but it's actually wash your hands. You know, we've just dropped that messaging over the last little while, and it's really important to wash your hands. And Nikki, I know, showed people the other day how to do that properly, and to do it for 20 seconds, and to use soap and water, and to make sure that you sing whatever song you want to sing, but, you know, sit there at the sink for 20 seconds and do it as often as you can throughout the day, because again, that stops you spreading it within your cohort of people that you're talking to. The third message is be kind to each other, and I reckon this community has really nailed that. I've been so overwhelmed by the support that we've received. Whether it's, you know, Wonthaggi Baker's Delight dropping down 200 hot cross buns for our staff, or the Wonthaggi Club giving us Easter eggs for our staff and patients at Christmas, or whether it's all of the people who have donated PPE, or whether it's just that child who writes us a note to say thank you for caring for us. All of those things are what will get us and this community through that. It's not useful in the media to be talking about whether the tourists should go home, or whether it's not useful to be talking about the numbers, because the numbers really, they're a point in time, and you know, the probability is, in fact the reality is, that there's many more people out there who have COVID now that we don't know about. 80% of people who have COVID-19 will not require hospitalisation. Some of them won't even have symptoms. And so, you know, the numbers count is sort of a little bit immaterial. I think the material issue is, let's just really do those first two things and be kind to each other and to all those people who are struggling through this.
Fantastic information. Before you go, is the building still continuing for the new Wonthaggi Hospital?
Absolutely.
Oh, that's
we
good.
we are so proceeding with all of the works at Wonthaggi. There's at the hospital. We've got TS Constructions who won the tender to actually start the car parking, and there's a whole lot of work happening. Social distancing bulldozers. You know, Trevor's done a great job there. And we're behind the scenes doing all of the plans. So it's a really good time for us. All of the planning can happen in offices and people's homes, in the architects. So we've done all of our social grouping around that. And we'll be ready to kick off with the building works, hopefully, when the pandemic's over.
Jan, can't thank you enough. Full of information. Appreciate your time, and we'll talk to you again sometime soon.
Thank you for having me.
Jan Child, CEO of Bass Coast Health. We'll be back with another update soon. Until I see you again, take care.